Here at the Canadian Club, we have always been a forum for public figures, thought leaders, and decision makers to share their ideas and inform the most relevant and compelling conversations of our time.
We are dedicated to encouraging debate on the issues that matter to this city, this province, and this country.
The Canadian Club is one of the most important podiums anywhere in the world that a Canadian can speak to, tell Canadians what it is that they think, develop those thoughts. And so I want to thank you for that very, very much.
Please join me in thanking our esteemed panelists today.
Through our programs and events, including our youth and young leaders programs, our diversity partnerships, our joint events, and our media and social media opportunities, we offer you access to dynamic political, social, and business figures from abroad and right here at home.
The platform from which the eloquence of Canada has flowed all of that time, whether it be business, education, politics, sports, arts, and culture. If someone wants to say something to Canadians about this country and about the future of this country, this is the venue you choose.
Hi, everybody. If I could just have your attention, I hope you enjoyed your meal as well as the table conversation. We are now ready to get going with our program. A special welcome to those who are joining us online, thanks to Van Valkenburg Communications and livemeeting.ca, our AV service providers. Our club wishes to express its appreciation to PwC for generously sponsoring today's event. And thank you also for our season sponsor, the Canadian Bankers Association. And one more round of applause for our airline sponsor, Air Canada. Thank you. Now, as you may know, we have partnered with Canada's Forest Trust, an ESG company planting smart forests to take action on climate change. Thanks to the Trust, we are reducing the carbon footprint of our entire event season. Now, as I stated earlier, our guest of honor, Bernard Lord, is the chair of the Canadian Life and Health Insurance Association and CEO of Medavie. If you have a question during Bernard's presentation, please use the Q&A cards on your table to share your question. We will also collect them and provide them to Carly Weeks, our moderator. For our online participants, please hit the question button on the right-hand side of your screen at any time during the broadcast. And now, I would like to turn things over to Keegan Isles, partner at PwC Canada, who will introduce our special guest and our moderator. Keegan?
Good afternoon, everyone. It's a pleasure to be here. I'm delighted to provide just a very brief introductory remark before welcoming Mr. Bernard Lord. Our purpose at PwC is to build trust in society and solve important problems. We bring this to life through our new global strategy we call the New Equation, which really centers on two key pillars: trust and sustained outcomes. Two things I think we can all agree are going to be critical to solving healthcare into the 21st century for Canada. Conversation I'm sure that Bernard and Carly will get to shortly. I think our society today is facing a series of concurrent challenges, from demographics to digitization. It continues to evolve, and unfortunately for many, remain difficult to navigate. I think everyone has seen the press around the access to primary healthcare physicians, surgical backlogs, and particularly, and poignantly coming through COVID, access to mental health services. All of these are day-to-day challenges Canadians face, and ones that I think we all need to reflect on. So, what are we to do? That's the topic of today. So without further ado, I'd like to introduce Bernard Lord. Bernard has been the Chief Executive Officer at Medavie for almost 7 years. He was a board member of the company before becoming CEO. He also worked as the CEO of the Canadian Wireless and Telecommunications Association for an 8-year period beginning in 2008. His healthcare leadership includes chairing the International Federation of Health Plans and serving as president of the Canadian Association of Blue Cross Plans, in addition to chairing the CLHIA, as Ali mentioned. Mr. Lord also has an impressive political track record. He was elected to the New Brunswick legislator 4 times, and served as Premier from 1999 to 2006. As mentioned, moderating our discussion is Carly Weeks, Globe and Mail health reporter and journalist. So without further ado, Mr. Lord, the stage is yours.
Thank you very much, Keegan. Good afternoon, everyone. Bonjour à tous. I really appreciate the kind introduction. I've been introduced before as a used car salesman, criminal lawyer, and a politician. That's usually used to elevate my credentials. So thank you very much. It really is a pleasure to be here at the Canadian Club. And today we're going to talk about a topic that's certainly top of mind for a lot of Canadians. And what I want to do a little bit is to try to demystify some of what we know about healthcare and share some solutions, and more importantly, have a conversation with Carly and take any of the questions that you would have on the topic. So I'm happy to answer any questions at all. But first, I want to share a few slides just to set the context of this conversation that we're going to have together. So I'm extremely pleased to be here, as was mentioned, as the CEO of Medavie and the chair of the CLHIA. Medavie is a health solutions partner in Canada. We manage Blue Cross, Medavie Blue Cross, and also Medavie Health Services. And the CLHIA is the Canadian Life Health Insurance Association, and it is a voluntary trade association. It represents all life and health insurers in Canada. Our sector is in the business of serving Canadians, and whether it's through health benefits, retirement savings, and pensions and life insurance. So when we think of, let me just go to the next slide here. So healthcare clearly has become one of the challenges of this generation. And you see some of these are just recent headlines from different news stories in Canada. Canadians worried about the state of provincial health systems. Canadian ER face record wait times, closure amid labor shortages, and resurgence of viruses. Too many people are struggling to pay for their medication. I thought I might die at home. Canada's healthcare system is crumbling. These are just some of the headlines. There was a recent poll in one province that stated more than half the people in that province felt the healthcare system would not be there for them when they needed it. So this is a real challenge. And when we look at the challenge, of course, there's some reasons why we face that challenge today. And we know just in recent weeks, and brought back great memories for me of premiers getting together and asking for more money for healthcare. It's something you do you just practice that at home. You know, when you're a premier, you just look in the mirror, Prime Minister, we need more money for healthcare. And, you know, there's deals, and deals are being signed individually with all the provinces, and that's good. I think overall, is it good for the healthcare system in Canada? Absolutely, it is. Is it the only solution we need? Unfortunately, no, it isn't. And we have to make sure that the money is, in fact, not a detriment to other solutions that are required to solve what you read here and some of the problems that we face. And when we think of government spending, and someone was asking me this before lunch, and I went back to my time as Premier. So during the time that I was Premier, I'll just simplify things here, and you have to, you know, you live here in Ontario. I think the numbers are a little bit smaller when you think of New Brunswick. But the budget for healthcare in the 7 years, the 7 budgets that I tabled as Premier, the budget, overall spending of everything in the budget went up by $1 billion. Healthcare spending in that same period of time went up by $1 billion. Education spending went up by about $200 million. And we ran balanced budgets and we cut taxes at the same time. So that means everything else received less money. So think about that. Just if you forget everything else, budget went up by $1 billion, everything, healthcare went up by $1 billion. So the challenges that are faced today by premiers are not new. If anything, they're just getting a little bit more complicated and a little bit worse. And when we think of our Canadian healthcare system, and let me say this, we're at the Canadian Club. I want to start by saying this. I don't know where this quote came from, but I've used it several times, so I don't know who said it, but it's not me. But when you are born in Canada, it's like winning the geography lottery. You win just by being a Canadian. You win just by living here. You win in terms of rights, opportunities, equality, and just the vastness of our country, quality of the air, the water, everything. You just win by being here. And I am a proud Canadian. And so when I see something like this, but unfortunately, when we look at how are we doing on certain things, I think it's important to have a frank and open conversation in Canada. What are we doing well and what is not working so well? And when you look at this slide comes from the recent study of the Commonwealth Group. And you may feel good, you say we're in the top 10. The problem is they only look at 11 countries in this study. And sometimes as Canadians, we like to compare ourselves, and we certainly like to compare ourselves to the United States. And so we look at the healthcare system in the United States, and we can see they're doing worse than we are. And if you only compare yourself to the United States, say, well, then we're better than our neighbor. But if you compare to other countries from around the world that share similar values as we do in Canada, values of access, equality, fairness, quality, all those things, we're 10 out of 11. So it indicates that we have some progress to make. We have some work to do. And I want to be clear about something. This is not a reflection of the people that work in the healthcare system. We at Medavie employ thousands of healthcare professionals, and what I've seen in the last 3 years is just remarkable. They are dedicated, they are selfless, they are professional, they care about their patients, and they go above and beyond what is required to make sure that their patients get the care that they deserve. And you'll find that everywhere in the healthcare system in Canada. So this is not about a reflection of the people in the system. It's just a reflection of some of the decisions that we have made through the years to get us to this point. And it shows that we need to make some changes. So, of course, demand for healthcare is increasing. In the next 2 slides, I'm going to talk about that. And this part of the problem was predictable. I remember studying economics 40 years ago. Yeah, it was 40 years ago. Studying economics, took a course in demographics, and our professor talked to us about the demographic challenge that was going to hit Canada. And I remember then writing a paper on how we needed to change healthcare to meet that demographic challenge. Well, it's here. This was predictable, and it's here today. And you can see it's not going to stop. In the next 12 to 15 years, the amount of people 65 and older in Ontario will grow by 57%, and in Canada is 54%. And when you see where we spend healthcare, you can see it here. Of course, this is obvious. I'm telling you things that are obvious, but sometimes it's important to know the obvious before we have a conversation. As we get older, we consume more healthcare. And the curve really increases when you hit 65. It really goes up significantly. So when we think of all this, we say, okay, there's a demographic challenge. There's going to be more people needing more healthcare. Yes. But there's another dimension to this growing demand for healthcare. And sometimes it's forgotten when we talk about what do we need for healthcare. And that's the fact that there are new treatments, new medication, new things that were not available 10 years ago that Canadians want and deserve. And that's also very important. You can think of biologics. There's people here from the sector, we cover biologic drugs. 20 years ago, that wasn't a big thing. New drugs for diabetes that are far more effective that did not exist. I remember when I was first elected Premier of New Brunswick, the wait time for a CAT scan in the province of New Brunswick was 0 days because there was no CAT scan in the province of New Brunswick when I was elected Premier. And now, you wait. Now, is it better waiting for a CAT scan or not having wait time? Of course it's better, but you'd prefer to have it sooner. But it just shows that it's not just a question of more people aging that will create more demand. It's also the other dimension of new treatments, new medication that people want. And frankly, as Canadians, we expect that as we live in one of the best countries in the world. We want that for our people, for our families, and for our patients. And that is the growing challenge of the aging population. But of course, there's another dimension to the aging population, is the aging population of the healthcare workers. So you can see the same curve applies to people that work in the healthcare system. And so if we collectively don't find the right tools to make sure that they can do their work, they will simply age out sooner than they want to. And when I meet with professionals in healthcare, they want to work. They care for they're so dedicated. It's just remarkable. I've mentioned that, but it's something that's worth repeating. And so we need to make sure that this curve, we need to help the aging healthcare workers so they can help us age as well. And that is a real challenge when we look at what's happening in healthcare. So all that to say is the healthcare needs are there, but Canadians are ready for a change. Perhaps in a way that most of us haven't seen in our lifetime. When we ask Canadians what they want, we see that Canadians are ready for change. And Canadians know that we face serious challenges, and Canadians tend to be very pragmatic. In a recent poll by Ipsos Reid, the majority, 85% of Canadians indicated they believe drastic changes are needed in the healthcare system to meet the needs of the community. 59% expressed support for the private delivery of publicly funded healthcare services. Our sector has been there, along with the public system, to supplement healthcare and also work on prevention, because sometimes the focus is always on the sick care component of the healthcare system. But the people the organizations that are members of the CLHIA are organizations that work with Canadians on prevention. We're strong and big believers in prevention, and prevention not only for the physical health, but also for the mental health. And you can see here as well, I think there was one slide that was, I can't go back, okay, we'll go here. And so when we ask Canadians what they like as well, you can see that 90% see group insurance coverage as a positive component of healthcare. 88% value their benefit plan that they have. 84% say it has been very or quite helpful with the cost of living. And among those that don't have an employer group, 71% would like to have one. 62% of people surveyed preferred a healthcare system that includes both public and private health delivery, provided costs are covered by government or insurance plans. So it shows that the attitudes and the willingness of Canadians to explore new solutions is real. Real in a way that we've not seen in my lifetime. You know, for my time in public life, talking about private sector in healthcare was viewed as the third rail of politics. Maybe the only thing that challenged that in a province like New Brunswick was language. So it just shows that there's an evolution in how people are willing to see these things. I mentioned our sector is involved in healthcare, and this is one of the myths that sometimes prevails in Canada, that all healthcare is public, that is publicly funded, publicly delivered. That is not the case. Different ways of measuring healthcare, you can usually go 3/4, 1/4, 70%, 30% of healthcare is publicly funded, and 30% is privately funded through insurance. And you can see here some of the work that we have been doing to serve Canadians. You can see that $40 billion have been paid in 2021 in health benefits, and $30 billion of that is in dental and drug coverage for Canadians. So when we think of all of these things, there's a few things that will be required, and Carly and I will have a chance to talk about this and answer your questions. But beyond money and supporting resources, we're going to need to innovate. And innovate, sometimes the first thing that comes to mind is new technology. Well, that's part of it. There's now diagnostic tools you can use. You take your phone, you look at it for 30 seconds, it will tell you if you have blood pressure issues or your cholesterol level. That's Canadian technology that was developed in Canada. This is not Star Trek, this is real. It's in the market now, and it works. But that's one component. Okay, you can say, oh, AI is going to help us. Absolutely, AI will help us. It will help us support professionals in providing better diagnostic to patients. But when we think of innovation, the most critical component of innovation is innovating the way that we think. If we don't innovate the way that we think about healthcare in Canada, we will not be able to meet the challenge that is in front of us. And if we're simply thinking, great, there's more money coming in, let's just do a little bit more of what we did before, it won't be enough to meet the growing demand and meet the expectations of Canadians. So as an industry, as a sector of the economy, it's very important to us to be able to contribute. And I've added this slide, and this slide is not directly related to healthcare. But what it talks about is the fact that we want to innovate. And every day the members of the CLHIA, except for when we meet as a board, on those days we're very cordial. Every other day we compete. We compete. And you can think about what happened in the pandemic. Some of us came up with virtual visits. Now virtually every group plan in Canada has virtual medical visits. Better mental health coverage increased significantly during the pandemic. And now virtually every group plan in Canada provides additional coverage for mental health compared to what it was 3 years ago. Now that's the type of innovation that you get in a competitive market when you're trying to meet the needs of the customer. And I don't think that's a need, and you see 3 other companies doing it and gaining market share. You say, well, we better do that too. And how can we do it better? And that type of innovation is healthy and can be helpful in sectors like healthcare as it is in other sectors of the economy. Now, we know that it's important that we work in a regulated environment. We understand that. But there can be a time when there's too much regulation at the same time. And so we think in Canada, we have to be careful that we don't tip the balance too much on too much regulatory burden. And there's a time and a way to do this. One thing, and I've had the pleasure with Stephen to meet the regulators, and we do this on a regular basis. One thing we ask them for is, can you try to get together and agree on some regulation? Because sometimes it's not that one regulation is better than another. What I mean, the one you have in Ontario may not be better than the one you find in Quebec or Alberta or BC or New Brunswick. Sometimes it's just different. But different means additional cost. Additional cost means a higher burden for the consumer to no benefit. So there's ways to improve that. Now, frankly, we as an association, as an industry, we can do better as well. And it'll be one of our topics at our board meeting tomorrow. What can we streamline ourselves without the help of government? Streamline forms to make it easier for physicians and so on. But that's part of the imposed regulatory burden, but there's also the unimposed regulatory burden, but there's also the imposed regulatory burden of the government that we have to make sure just do it at a pace that we can absorb it and continue to focus our attention on the patient and innovating in our products and services that we offer. So my final words would be that as a sector, we want to do more in health. And I look back my first meeting at the CLHIA just a few years ago to where we are now. As a sector, we talk more about health than we did 3-4 years ago because we know there's a need and we want to be part of the solution. We also know that it's important for us in Canada that we rely on those that are dependable, and this sector is dependable. Throughout the pandemic, we didn't shut down our offices. In fact, through the billions of dollars of investments that were made by this sector of the economy, we were able to continue to provide all the services that we were providing before, even in the middle of a pandemic. And of course, that was important for Canadians to know that they would get their medication, get the care that they needed, even in a pandemic. So my message today is we have a big challenge ahead of us. This sector, this industry, this group of companies want to be part of the solution. We have been, we are, and we want to continue to be part of the solution. And frankly, to be able to do that, let's not get caught up in buzzwords like Americanization or private care or two-tier. Let's have an honest, open conversation of what we can change. And frankly, if we decide to put the patient first, really put the patient first, put the patient ahead of ideology, then you'll find there's some real solutions out there. Put the patient and providers ahead of ideology, and you'll realize there's some really good solutions that can be implemented. And not everything will be perfect, and that's okay. But that is what we can do if we work and we allow others to participate. If there's too much centralization, too much central planning, it will not work. We will not meet this challenge. And frankly, the health and well-being of Canadians depend on us meeting this challenge. And I know there's people in this room and members of the CLHIA we're ready to tackle this challenge. Thank you.
Nicely done. Hi, everyone. As you know, I'm Carly Weeks, and I now get the privilege of speaking with Bernard and asking some questions about how do we get to the healthcare system that we want and need. I think that everyone in this room probably has a story about how the healthcare system has been challenging them, or a loved one or friend. We all are kind of living this experience right now, and I think it is really top of mind for everyone. How do we get to a better system? So, you mentioned how premiers always get together. We have these big discussions about funding. We just signed in the last week, provinces are signing $200 billion into over 10 years of funding. It's an obscene amount of money, and we see that our outcomes are not improving, and if anything, they're getting worse. So, just as a former premier and someone who has a big stake in this, why isn't more money getting us to where we need to go? And talk to us a little bit about your perspective on how we can get closer to the system we deserve.
Well, first of all, it's not easy. No one has a simple solution for healthcare and say, just do one thing, everything will be okay. That doesn't exist. And as I mentioned, when we think of all the additional money, and I can look back at our own situation in New Brunswick at the time, we invested that much more in healthcare. Did it make a difference? Absolutely it made a difference. I joked about no wait time for a CAT scan. Well, after a few years, we had CAT scans, and we had more CT scans, and more diagnostic, more nurses, more doctors. But the truth is we're trying to keep up with increased demand. And that's where, sometimes just, let's try to do more of what we were doing. The demand is growing faster than our old capabilities. So we need to innovate. We need to change how we look at it. Money is one very important component. You can't fund the healthcare system. You can't pay people in this system without money. And frankly, when I see how people are working in the system, they deserve their pay. They deserve a better pay. They deserve better working conditions as well. Without that, what we see is people are dropping out. And we can remember 3 years, 3 years ago, remember the start of the pandemic, there were parades for people working in the healthcare system. Now you read stories of people, nurses being attacked in the hospital. Like, what happened in 3 years? So I think we need to go back to where we were and realize how important these people are in the system. So money helps to pay them better. But money in itself will not solve this problem.
So what are some of the ways we can, innovate to get there, change things to get there? And as you said, it is kind of this, conversation that a lot of us are uncomfortable having, changing things. It's always been done this way, since the 1960s. So, what are some of the ways that you think could really lead to meaningful change, reducing those wait times, making working conditions for nurses better?
Well, we've seen some ways just in the pandemic. Several of the benefit providers have provided virtual medical visits during the pandemic. And the attraction of that became obvious to Canadians, that people wanted it. Like, please, sign me up. And they were using it. They're still using it today. But now we're seeing that this new innovation, new for Canada, by the way, it wasn't new to the rest of the world. In my role as the chair of the International Federation of Health Plans, I've met CEOs of other health plans from around the world that were doing more than 50% of their medical visits were virtual pre-pandemic, not post-pandemic. So this new technology to us as Canadians, where there was less than maybe 1% before the pandemic, now we see some governments wanting to say, well, that's not right. Maybe it goes against, it was okay during the pandemic because we really needed it, but maybe we should regulate this more. I think we need to open the doors. Let people have these options to make sure we can connect patients with providers and make it easier. So that's one way. We've added better ways to support mental health using technology just over the internet. There's AI technology that exists in other parts of the world that are being used today. This is not the future, this is now, where AI supports providers. And you can have diagnosis done by AI rather than having an individual. So when we think of the aging population of our providers, we'll need to supplement them so they can focus their time, their precious time, on doing the things that only they can do and not AI or other means. Mm-hmm. That's part of innovation as well.
And that's really interesting, and I think we are obviously, as you say, at a time where Canadians are looking for different solutions. One of the things that did come out of the recent negotiations with the provinces and territories is a national plan for better data collection.
Yeah, absolutely.
Sounds so boring, but it's actually really vital. I mean, no one can really say with any certainty, where in any given province there's a shortage of nurses. We know there's a shortage, but we don't quite know why, or how many do we need to get properly staffed. So I was wondering if you can tell us a little bit about how that change could lead to, or just collecting that data could lead to meaningful change, and how your sector can be involved in that as well.
Well, I mean, that's obvious. So the answer is yes, it can. And our sector uses data to assess the risks on the individual. For life insurance, you need data. You need a lot of data. And the more data we have, the better we can be. And that's the same with healthcare, public healthcare. And so having access to better data we can design systems differently. We can also know, I showed some charts of healthcare spending over the age groups, but when you think of about 50% of public healthcare spending goes to about 5% of patients every year.
It's wild.
And that's a known fact. So knowing who will replace those 5%, and having more prevention to better manage care and design some care to delay diabetes, to delay cancer. And you say, well, can you delay cancer? Absolutely you can. Not for all cancers, but some cancers you can. You can change behaviors. And the other thing I think has to be very clear. Yes, the sector. I'm here as chair of the CLHIA. We have a role to play. We talk about the government. The government has a role to play. Each of us have a role to play in healthcare as well. Like we do have an impact on our individual health. So it's not one thing, it's not just one group, it's not pointing the finger at government, and that's certainly not my goal here, because I know how difficult and how complicated it is for premiers and for the federal government. But I still think there's things that we can open up and do better and will provide better results. And when you think of simple things of providing care to where people are, rather than always bringing them to the care. So this is the Medavie commercial. Stephen, apologize, but this is a Medavie commercial. So at Medavie, we manage, we bring care to where people are. And we've partnered with different governments to change how certain groups of seniors would get care. And we reduce, in some cases, by over 75%, over 3/4 of visits to emergency departments were reduced because we would bring care to the individual rather than bringing the individual to the care. We also manage ambulance systems. So it's just a different way of looking at the problem. And then when you have better data, you can plan that in advance.
And obviously, that's an exciting possibility. On the flip side, there are so many experts and advocates working in the system who say that opening this door can lead to an erosion of health for everyone, and especially those who are more vulnerable, who struggle already in the current system. So, when you have those conversations with people, you hear that pushback, don't touch this system, it needs to be universal, we need to make it better through, government means, public means. What is your response to that? Because that's obviously a very strong voice in the room as well.
Yeah, it's a voice that needs to be heard, absolutely. And I'm not advocating for saying everything needs to be private or everything needs to be paid by the private. I'm certainly not advocating that everything should be paid by the government, everything should be public. And when you compare Canada to other countries that share similar values, the countries showed on the chart that we had before, countries that they share our values. You have countries like Denmark and Sweden, Germany. They're countries that share similar values of universality and access for everyone. They just do it differently. They have specialized, some cases for-profit, some cases not-for-profit clinics that do just hips, that do just knees, and they have better results. Not just that the operation is better, there's less people going back to the hospital after.
Right. And
so you're eliminating some of the burden. So there's gains not only in efficiency in a traditional industrial sense, there's gains in quality of life for the patient. And that's why I go back to the fundamental premise here has to be put the patient first. And if it's demonstrated in other Western countries that when you have specialized hip clinics, the result is better for the patient, why let ideology get in the way and prevent that in Canada?
There was a question, and it's sort of an observation, but I think we can turn it into a question. But I mean, basically, do Canadians even realize how much of our system is already private? How much delivery is private? And I think when we're having that conversation about innovation, we seem to have some misconceptions about what our system is and is not already. Can you share a couple of perspectives on that? I have a feeling you'd have something to say about that.
Well, there's a lot of Canadians. I have a lot of things to say about a lot of things, obviously. But there's a lot of people who think that the whole system is public, completely funded by the public, and it's just delivered by government. It's not the case, and it shouldn't be the case. And I certainly don't want it to be the case. It would make things worse than they are today. We need to open this up and allow other organizations, other people, other types of organizations that want to participate. And sometimes when we have the discussion, it's important to make the difference between what is publicly paid and privately delivered. And you'll see a lot of Canadians are actually very open to that idea, very open to the idea. But if you take everything that is private now and you say, oh no, let's eliminate that. Let's go the other way. Let's make it all government. One thing, when I travel around the world and I meet with the other CEOs of health plans from around the world, there's nobody around the world, and I love Canada, but there's nobody out there saying, we want Canadian healthcare. Nobody, seriously, nobody's saying, they may say, we want to play hockey like Canada. But nobody's saying, let's have a healthcare like Canada. Let's have that system. It doesn't exist because they see the results. And I think we have to, if we really care about patients, then we'll have an honest conversation in the country and say, we can do better. And there's ways to do better. And again, I say, take the ideology out of it. Put the patients first. And you can have a system that is accessible, that is affordable. We talk about the system now, and some of the defenders of the status quo say it's the best system, it's universal. There's millions of Canadians that don't have access to primary care. So is being on a wait list the definition of being equal? It isn't. Let's stop kidding ourselves. That's not healthcare. Waiting. The definition of patient shouldn't be that you are a patient to get healthcare.
I mean, and that's why we do see a lot of the wait times in our emergency rooms out of control. I mean, I've talked to plenty of emergency physicians who are, refilling prescriptions for people because they literally have nowhere else to go. So, if we're talking innovation, I mean, how can we innovate our way out of that? I mean, we have millions of people without primary care providers. So when we talk about some of those real core aspects of this crisis, which just kind of feeds into one of the questions as well, like that's one of the key crises we're facing. What are some of the other ones? And how do we innovate to get out of that? I mean, we can't just produce doctors overnight, right? So, no. I mean, can we?
No, and for years, governments across the country, provincial governments, tried to limit the access of nurses and physicians and other health professionals because it would be too costly. You can ask any premier in the last 25 years, they ran for office, didn't realize they would become health minister. But that's what happens. You can talk to finance ministers. They didn't realize they were going to become health minister. Your whole cabinet becomes a health minister because it dominates the conversation all the time. And as Canadians, we should expect, we want healthcare. It's normal. We're a rich, wealthy country. And let's make sure we stay that way. I mean, there's other things we can talk about. Let's make sure we stay a rich, wealthy country. But part of that is you expect a certain standard of care. You expect to get world-class healthcare in a top world-class country like Canada. So when you think of that, there's, as I said earlier, there's not one thing that will do this. It's 100 decisions. It's 1,000 decisions. It's trying things, and maybe one province tries one thing, and the others look, man, I don't want to do that. Okay, but if it works, I'll do it. If it doesn't work, I'm glad they tried that. It wasn't us. But that's part of the beauty of being part of a federal system, and that's how we ended up with the healthcare system we have now. It started in one province. The ideas were fantastic. People loved it, and it went across the country. But with time and changing demographics, we need to make some adjustments to it. And by no means, I want to be clear, either on my behalf or on behalf of this, no one's here suggesting throw it all away. Not at all. It's just opening it up, saying, okay, clearly the results are not what could be expected for a country like Canada. How do we make it better? Staying the same and just saying everything will be the same is not going to cut it. And when you have more actors that can innovate and bring things to patients, the better it is. So, and the other thing we see is Canadians that don't get the care through the public system, they'll find other ways of getting it if they have the means. So this idea that everyone's exactly equal, it doesn't exist. If you have the means, you'll leave the country. I'm sure everybody in this room knows someone that went and received care in another country because they couldn't get it here. And if you work at, if you know certain people, you don't wait as long as others. Let's have honest conversations. Let's stop pretending that we live in this Pollyanna world and you get your number and you wait. No. So why is it the same people always end up waiting? So let's open it up. Let's make sure we can support everyone better.
So let's say you get your wish. We have one of these systems like you see in Europe. Let's stop comparing ourselves to the US because that's not a very helpful comparison, I don't think. What does that start to look like then? I mean, we have governments that are focusing on getting our hospital backlogs cleared up, and we have the insurance sector coming in to provide additional support. Like, what does that kind of look like, and how else do you see the industry kind of evolving in that way?
Well, the industry is there to meet the needs of people. We respond to what our customers ask for, and if we don't, somebody else in the industry will, and your customers will go to them. And as I said early on, that competition is helpful. It's brought a sector that is rock solid to Canadians. You can depend on this sector. And we saw it in the pandemic. There's no risk that your benefits won't be taken care of. No, they'll be taken care of. There's more risk that you may not get the service you want or you'll wait, but we'll provide the claim. We'll do what we need to do. That works well. And more of us now are looking, okay, what else can we do? Let's go the extra mile and let's be more active. Let's enhance this health component of what we can provide. Go beyond the traditional part of the sector. That should be welcome. There's so much work to do in healthcare that we don't need to shut people out. And I want to be clear, Carol, I'm not suggesting let's adopt the Netherlands system or the German system, whatever system you want. No, it has to be a Canadian system for our needs and who we are. But I think we can accept that we're not in the same situation we were originally in the 60s. We're not in the same situation as when the Canada Health Act was reintroduced and changed. I forget the date, sometimes in the 80s. We're not even the same place we were when we had the Romano Commission that went around the country 20 years ago to solve all of this. No, it's evolved. Let's evolve with it. That's all. It's not about taking everything down. Quite the contrary. It's building on what we have, but opening some doors so other people can come in with solutions. And I don't have all the solutions. Nobody in this room has all the solutions. But there are Canadians. There's innovators that come in and find better ways to connect establishments that need nurses and nurses that want to work. And they're doing it in a different way. And they're doing it in a way that appeals to the establishment, that appeals to the nurses. Well, that's great. If you would have waited for government to, and this is no disrespect to government, it's hard being in government. It is difficult. Things are more complex than they've ever been. Canadians expect more. I get all that. That's why let other people innovate. Let it happen. Just open it up. What do we have to lose? Really, what do we have to lose? No, we'll stay the same. Don't change anything. No, let's just keep waiting in line a little bit longer.
We need to hold on to our number 10 spot on that list, right?
As I say, we're in the top 10.
We're going to be wrapping up in just a couple of minutes, but I always come back to this question of, there's more of an openness to change. Canadians are showing that. People are very frustrated. What does it take to get us there? Is there going to be, governments have sort of been, let's just say there's not a whole lot of innovation happening on that side of things. We're spending more money for the same or, worse outcomes. So is there a realistic path forward to actually change the system, to make it better, so we're not all waiting so long?
Two things I'll say on that. One is, if governments had to deliver healthcare like they did 20 years ago, there'd be a surplus of money and a surplus of people. We're providing more care to more people in Canada than ever before. So when we think that things are getting worse, it's because demand is outpacing supply. That's my studies in economics, so my degree in economics is paying off. But it would be inaccurate to say that healthcare is worse today than it was 20 years ago. it's better. But you wait longer because it hasn't kept up to the demand. So I guess maybe some will say, if you wait longer, is it really better? Okay, but there's more healthcare, there's more treatment, there's more intervention, there's more things being done to help Canadians publicly and privately in Canada than at any other point in our history. It's still not enough. The second thing I would say is, you look around the country, actually there are some premiers that are saying, yeah, I'm going to do things differently. And they're trying things. And I've met several premiers in the last 6 months and health ministers from across the country. And there's a sense of urgency that is real. They know it, and they want to change. And I think they're looking and they're feeling the wind that is coming from, the wind in their sails is coming from Canadians saying, you got to change this. Like, we're open, try some things. And, no one's saying they don't care about anybody else. No, they just do things differently, make things better. And you get that sense. So I think we shouldn't be too hard on the elected officials. They are willing to try. Money was one component. Now they have more money. You mentioned data. How do we use data? How do we use data to improve knowledge and improve how we deliver care to get better outcomes? It's there. We do it in our sectors. Other sectors do it as well. There's virtually every sector of the economy uses data better than they did before. Healthcare can do the same. And it shouldn't be that hard for provinces to agree to share some data with others. In fact, even the data that we collect as a private sector, without breaching the individual privacy of individuals, some of that data could be shared to make better decisions as well.
That's a really great and hopeful point to end on. So I just want to thank you for that. And for also highlighting the very great work that our health professionals are doing. Our system is not working, but the health professionals who are in it are outstanding. And
they're working, they're lights out. Like, they don't stop. And that's... And just one last thing, I appreciate you saying that at the end, Kirk. I am an optimist. I've always been. And I look at what we're capable of in Canada, what we've been capable of doing before. The only thing preventing us from delivering better care is ourselves. And that's why when I talk about innovation, it's innovating the way that we think. We do that. We can provide the best care in the world, should be here in Canada. There's no reason, there's nothing preventing that other than ourselves.
I love it. Thank you. Thank you so much for injecting us with that.
Bernard, on behalf of the Canadian Club members and guests, I want to thank you for sharing your wisdom and insights with us today. As you said, issues that we are facing, whether it's patient access, resource shortages, system capacity, they're all placing a tremendous burden on our health system. It was encouraging to hear how the life and health insurance sector seeks innovative solutions to our healthcare challenges through a practical, patient-centric approach steeped in evidence-based decision-making. Your leadership at the CLHIA and at Medavie is critically important as we continue to find solutions for these challenges. We wish you every success for your passionate healthcare advocacy on behalf of the industry and the patients it serves. Carly, thanks for doing a stellar job as a moderator. We appreciate your time and expertise. Before we conclude, let me tell you just about our next event. On Tuesday, March 7th, we welcome Rania Llewellyn, President and CEO of Laurentian Bank of Canada, to our podium to discuss her ideas and efforts around equity and the power of mentorship, sponsorship, and allyship. Please visit canadianclub.org to learn more and to purchase your tickets. I'd like to offer another round of thanks and appreciations to today's event sponsor, PwC. Thank you for joining us, and we hope to see you again.